There we go. All right. Good afternoon, everyone. Welcome to Tune In and Tune Up. And this is going to be presented by the BNI Danforth Healthcare Team. And I'd love to introduce who that is. So we have Daryl Chung, who is a clinic owner at Satori Wellness. And he is joined today with one of his practitioners, Sean Castor, who we're going to be hearing from today as well. Hello, Sean. Myself, Rebeka, I'm the founder of Addo Living and a doTERRA wellness advocate. And I help people connect to natural products like essential oils and other plant-based products to support, their health naturally. And we have Dr. Lisa Weeks, who is a naturopathic doctor, really helps people get to the root cause of their issues. And we also have Colleen Santini, who does both meditation, yoga, and counseling for people going through trauma. She is an excellent communicator, and we're really happy to have the four of us together, all talking about ways that we need to be tuning in and tuning up our bodies. And well, it's kind of going to be a little bit of a panel-ish format, as in the four of us are just going to speak for a couple minutes each. So Dr. Lisa is going to start us off, and we'll move on to Daryl and Sean talking about tuning into our body. Dr. Lisa is going to take the baton from there, talk about Chinese medicine and a tongue diagnosis, and also what your poop tells you about your health. So we're going to get into the bowel movements today, folks. I'm going to talk about plant-based products that can support both our minds and our bodies. Colleen is going to end us with a talk on authenticity and communication. If you have any questions, you can ask them at our Q&A time. Feel free to put them in the Q&A section as we're going through, and we'll make sure to get them when it's that time and answer any questions you have. We have some next steps for you, and Colleen will end us in a beautiful closing meditation. So I'll pass it on to Lisa. Tell us a bit more about why we came up with this topic and why it's so important.
Definitely. I know a lot of us are so busy. We don't stop and listen to the warning signs that our body is telling us. We do a better job of listening to what our car is telling us, if it's making a funny noise or rattling, or if there's the gas light on or the oil light. We don't put a piece of tape over top and ignore it because we know that's going to become a bigger problem. But do you tune into your body and listen to those little warning signs that something is out of balance before it becomes a bigger problem? A lot of times we don't. So we want to really focus on that today and just carve out some time to create some space for that as well. Okay, next slide. And a lot of times we're stuck on autopilot. We're just trying to get through the day, right? We have to get the kids off to school. We got to work. We got to get dinner on the table. We don't typically step back and think about what our body is telling us, or even what we're doing to support our health. You know, are we doing things that are harming us? Are there things that we should start doing, like potentially drinking more water or getting to bed a little bit earlier? These small changes really add up and impact our health, and then prevent those warning signs from appearing. Are there things that you could benefit from stopping? Are you eating a bag of chips every night on the couch? You know, there's a time and a place for that. But are you also, sedentary? You're not moving. You've got to get up and start exercising. But then also looking at what is working for your health. What can you continue doing? So congratulating yourself on what you can do, because we can't do it all at the same time. But okay, if you're getting your vegetables in, that's fantastic. If you're starting your day with a wholesome meal, a wholesome breakfast, that's really going to serve you too. So we really want you to start to think about ways to enhance your health, to prevent warning signs in it from breaking down. And now I'll pass it over to Daryl and Sean, and they're going to talk about how to tune into your body.
Hi there, everyone. It's great to be here. I'm just going to be briefly talking about, talking about the signals our body is giving out, just like this radio tuner that we have here. At times the signals are, easy to interpret what the body is telling us. Touch a hot stove, for example, and to kind of pull away from that. If you eat spicy food, to drink some milk or some water. But sometimes the body sends out some signals that we aren't sure what to do with them. Sometimes there are so many different signals, we don't know which one to pay attention to, which radio signal to pay attention to. And sometimes you tune into the incorrect signal. So let me tell you some examples. When I had some back pain on the right side and I was getting a massage with Sean here, I didn't realize that, the pain signal I was interpreting on the right side, actually my left side is the one that needed more attention to. And it really helps when you have someone that's listening more accurately using their hands and their eyes and their ears. Another example was when I had some neck pain and the massage therapist worked on my hips, and that resolved the neck pain actually. So sometimes the signal here, we need a professional listener here. And so that's why I have here Sean Castor, a registered massage therapist here. He came back to the clinic and he learned a new technique called neurofascial reset technique. So instead of trying to explain it over a slide, we are actually going to demonstrate it. So if we can just stop the slide presentation for a second, and we're going to have Sean here show a technique here on you right now.
Yes, so it's called rapid neurofascial reset. It's a big name for very simple kind of techniques, specific. Anyway, so one example, so if I'm having some pain between my shoulder blades, or if Daryl is, I would press like on the edge of the shoulder blade and then get him to bring his arm across, effectively lengthening that muscle. And I'm pressing right onto the bone there because there are more neurons in the fascia that's surrounding the bone. So things like this is what I really like about rapid as opposed to massage therapy. And like its name, it's very fast and effective. And sometimes the results after like a 15 to 30 minute treatment can last for months potentially.
How do you consider yourself a professional listener?
Yeah, well, I kind of think of myself as an interpreter more than a listener, because some people will say, oh, I have this issue. And I think, okay, where is this coming from? Let's check out the different areas. And then also I will be listening with my hands. So I'll feel the area, and sometimes I have to close my eyes and feel. And then I'm like, oh yeah, there's a little area here that I feel needs a little more attention. And it's a lot of communication, especially in rapid, between the therapist and the patient.
I think that's where we're talking about our last treatment. It was like a partnership, actually.
Yeah.
We kind of work together back and forth to give the feedback. I think that's important. And how many years have you been professionally listening to body?
Yeah. It's coming up on 8 years in January. So it's become second nature at this point. It's yes. So when I try to teach somebody to work on themselves or on somebody else, like their partner at home, I tell them, close your eyes and listen with your hands, and you will be able to feel that area, that little muscle knot to work on.
Perfect. Becca, let's go back to the slides here. We can see how neurofascial reset actually can treat a variety of different options or different ailments. And here's just a brief list of some of the things that Sean treats. Sean is actually on the left, not the skeleton, right? And
I was on a diet, yeah.
A whole bunch of things, including back pain, carpal tunnel syndrome, TMJ, bursitis, and to a certain degree, arthritis. Just the next slide will also show you to talk about the differences between, he's a massage therapist, but also does his neurofascial reset. So the three areas and the differences between the two. The technique here is more kind of the pressure points that Sean works on, and then you're actively, the client's actually moving to release that pain point, where massage therapy is you're massaging the muscle here. The client is active and fully clothed during the treatment. During neurofascial reset. Massage therapy is passive, and you definitely wear less clothing. And the duration for the neurofascial reset is only for 30 minutes. So it's only for a short duration, where a massage could be 45 minutes or even longer, as long as an hour or 90 minutes. Any thoughts that you want to share, Sean, in this section? Maybe
one of the differences, like when people ask me, okay, what am I expecting? What should I expect? And I kind of say it's all of the benefit with none of the fluff. So if you're wanting something like a spa treatment, definitely book like a traditional Swedish massage, but you can't really expect those same results, lasting results, as you should with as I hope to have the results with Rapid.
Perfect.
Yeah.
And we've got one more slide, and I'll just quickly talk about it. This is my back issues that I had before and after with Sean. And so he was listening to my body and says, Daryl, you look like a boomerang. And he says, I got this neurofascial reset. Why don't we do this? And he helped to reset the body. The second picture is a lot more straighter by using his hands to listen and help to move things back into place and to release that tension there. Anyway, who else is a body listener is also Lisa Weeks. So Lisa is going to take it away and talk about tongue and poop.
Got to unmute there.
Okay, sorry if anybody's eating their lunch. We'll get to poop in a moment, but we'll go to the next slide. Thanks, Becca. So I want you to think about your body and what is it telling you, because it's pretty fascinating. When I do a physical exam with patients, I do a head to toe assessment. So looking at someone's inner eyelids, if they're really pale or if their gums are pale, that can be a sign of iron deficiency. If they have white spots on their nails, there could be zinc deficiency or mineral malabsorption or mineral deficiencies too. Stress symptoms, people might not be aware, but reflux can be caused by stress as one of the triggers. Even in terms of stress symptoms, insomnia is a big one, right? Trouble falling asleep, staying asleep. If people have hormonal imbalances, for example, thyroid, people don't realize, but if a third, like the lateral third of their eyebrow is thinning, that can be a sign of hypothyroidism, as can be hair loss on the head, cold intolerance, constipation, etc. And I see so many patients with undiagnosed food sensitivities, and it may not always show up in the gut. Yes, it can impact digestion, but they may have dark circles under their eyes. They may have eczema or skin rashes that they just can't get rid of, and they have to keep using steroid cream after steroid cream. So your body really is screaming for help with these symptoms. So you want myself or another healthcare practitioner to assess those and then dive deeper and investigate. So we'll go to the next slide. Thanks, Becca. And do you look at your stools? More people are, so you should be looking in the toilet after you go every time. I know it sounds kind of weird, but it really tells us about your gut health. You want to look at the shape. Ideally, it's long and formed like a banana. It's a fairly big size and is a pretty, thick piece, not too thin. You want to see that it's, medium brown potentially. It's kind of stays together, but I'll go through some warning signs to look for. So if we can go to the next slide. You may have heard of this before, the Bristol Stool Chart. This is how you can rate your stools. Normal is type 3 or 4, where it's either like a sausage, maybe with a little bit of cracks on it, but constipation is more type 1 and type 2. So you could be going, but it's more like rabbit pellets, or it's more dried out and lumpy. And then when you go between type 5 to 7, that's moving towards diarrhea, and you don't want to have that on a consistent basis either. And then even with the colors, for example, so if your stool is more green, that might be your stools going through you too quickly, and you might not have time to break down the bile. We know black tarry stools can be a bleed in the upper digestive system, like the stomach or a small intestinal ulcer. And then if you have yellow, greasy stools, that could be a problem with fat digestion, potentially with your pancreas too. And we do know medications can make your stools look different, like Pepto-Bismol can really change your stool as well. So sorry, we did this before the tongue. So we'll move to the tongues now, so we can advance, Rebecca. And do you also look at your tongue? It's pretty cool in Chinese. Different areas of the tongue correspond to different organs. The color of your tongue, the size, even if there's teeth marks at the side, the thickness of the coating will tell us what's going on with your health. It's pretty fascinating. So I'll show you a depiction of the different areas of the tongue next. So if there's issues or changes with color or swelling in different areas of the tongue, that can mean different organ malfunction. So if it's swollen at the back of the tongue, you might have issues with your kidneys or bladder. If you have a lot of redness at the tip of the tongue, that's the heart in Chinese medicine, which is the mind. So that can be some sleep issues. It could be overjoyed or lack of joy, potentially mood disorders. The sides of the tongue indicate liver and gallbladder, and the middle of the tongue represents the digestive area. So we'll go to the next slide. I'll show you some depictions of different tongues. So everybody's probably trying to find a mirror and take a look at their tongue, but a normal tongue is on the left. It's pink, it's not too big, there's no teeth marks, there's a thin white coating, you can't really see it here. That is a normal tongue. I commonly see people with a qi deficiency. This is someone who's really tired, they might have loose stools, this can be a spleen qi deficiency. This is a tongue that's really pale. It has the teeth marks at the side of the tongue, it might be small, the coating, you know, it could still be there, but I see this in a lot of people, especially if they're having diarrhea symptoms and they're just totally exhausted. Another common presentation of the tongue is the bottom left, the qi stagnation. So this is when stress levels run high, and during a pandemic, they're definitely higher than normal. They can be emotionally labile, right? So they're unstable. So they're switching from one emotion to the other. They might be crying and then they might be irritated and snapping at everybody. These are also people that can have PMS symptoms as well and hormonal imbalances. So it's pretty your tongue can tell you about your health. And I also do a Chinese medicine pulse diagnosis, which just enhances the diagnosis. So we'll go to the next slide, please. So then once I have that information from the physical exam and then from you reporting about your stools, then I do an inspection to confirm suspicions of what I think is going on by talking to you, by doing different laboratory tests, and then doing a therapeutic trial with whatever intervention, whether it's a supplement, a herb, a bioidentical hormone cream, even acupuncture, and then reevaluate and see how you're responding. So we'll go to the next slide. And then as a naturopath too, so yes, I see people for acute conditions when your body has broken down, if you will, but then I also schedule in regular maintenance appointments, just like you do with your car. I might check in with people once or twice a year when they get their blood test results, so I can review it with them and compare to the previous year. And then even just to keep them on track with their nutrients, their diet, their supplementation. And I can also prescribe different tools based on the concern. So I can prescribe herbs, I can use acupuncture, I can make recommendations on how to keep healthy habits, whether it's drinking water or getting to bed more or earlier, I should say, or moving or dealing with stress. I use homeopathy and hydrotherapy, which is water to heal. And then I'm even trained to use prescription hormone creams and a prescription thyroid medication for hypothyroid, which is an alternate to the traditional one. So we'll go, I think that's it for me.
Thank you, Lisa. I love learning about tongues and learning about poop. All right. So one of my favorite ways to both tune in and tune up is I love using essential oils. And from our last talk that we did, a bunch of people don't really use them. So I thought I'd start off really quickly, just getting us on the same page. So I have a bottle here of frankincense, for example. There's 250 drops of essential oil in here. And it's 1 drop per dose. So this lasts a long time. And what it is this bottle is filled with the aromatic compounds of a plant. So let's use peppermint, for example, because a lot of us used to or grow peppermint in our gardens. If you pick a peppermint leaf and you crush it between your fingers, it smells even stronger than peppermint than if you just smelled the leaf. And what you did there is when you crushed that leaf between your fingers is you actually burst open the essential oil sacs that are inside a peppermint leaf. So those little sacs that you're bursting open, that is what an essential oil is. And they are distilled in different ways. Most popular way is steam distilled. And that's exactly what gets into the bottle. Frankincense, for example, is from a resin of a tree. So from the resin of a frankincense tree is where we're getting the frankincense oil from. So that's what they are. And they all have different chemical constituents to them. They all have different benefits for our bodies, for our mind. So that's what it is. And that's why I love going to them to tune into myself, whether it be a physical tune in or mental, emotional. And so with the frankincense that I just showed you, I actually just took a drop in front of the whole team here before we started, because it is my in the moment, tuning in the moment oil. So right under my tongue today, especially just because I did feel quite overwhelmed today with just some news I got from a friend. And so my moment of tuning in is putting it right under my tongue. Normally in a day, I would just take the bottle and I would put 1 drop on my palms, It's all you need, 1 drop, and just inhale it. So just taking 3 deep breaths. And that's such a beautiful in the moment oil. And again, all the benefits that are in that plant, you're getting them by breathing them through your olfactory system. It triggers your limbic system, sends messages to the rest of your body. So it really is a beautiful thing to be using in the moment. Here's some benefits of them. So not only just inhaling them from your cupped hands, but you can diffuse it. You can add it to your skin at night, tune into your self-care kind of thing. Use it on your head for head tension. You can put it on your stomach to soothe your stomach if you're not feeling so well. Maybe if one of your poos looked like some of the ones that Dr. Lisa was telling us about. And it's a beautiful oil for prayer and meditation. So that's my recommendation for tuning in the moment. For a longer term tune in, if you really need help with like tuning into your emotions and just how you're feeling mentally, I love the adaptive capsule. So this is a plant-based capsule. It's incredible for me. I've never experienced anxiety until the pandemic. I realized, oh, that's the difference between stress and anxiety, right? It's just that longer term feeling. For me, it's like someone's like kind of pushing on my chest. So this is all natural. It has GABA. It has other beautiful floral plants in it just to help you really feel calm. So that's like a longer moment for tuning in. For tuning up in the moment, I love this thing. I have it in my bag. It's a deep blue stick, so it kind of rolls up, and you just kind of ask yourself, all right, where do I need to tune up in this moment, right? I always go for my back shoulders because that's where I carry my tension, but just rubbing, it's all the plants that have been studied to help with inflammation, and it's really great for arthritis, any kind of joint or muscle pain. So rub it right on your back, rub it on your wrists if they're feeling sore, on your knees. A lot of massage therapists, physiotherapists love the deep blue line because it's just a really, again, I call it, it works. It's just that it's a bit of a Band-Aid, right? If you're feeling sore, you got to go see Daryl and Sean, right? This is like a in the moment, just kind of quick little tune up, help the inflammation in that moment. Longer term wise tune up, I really recommend, oh, here's a couple of things. I jumped ahead of myself here about the deep blue stick. So I love that it's quick drying because we do have it in a cream format. This one's really quick and easy to put on, very cooling, very soothing. Like I said, you feel it within seconds. So if you want that like immediate, like, oh, I just needed something to relieve me in the moment, this is going to be your best friend. So the longer term one, I really suggest, like, I love the image of Daryl with the radio at the beginning and just kind of turning the knob and finding that right station, right, to like really tune into yourself. And I see this line of supplements here, they're called Lifelong Vitality, as that tune up, because it can, I picture like the kind of dials, you know, all across the board and all these different things to turn, and you're upping your sleep just a little bit with these, you're upping your skin a little bit, your energy, your hormones, everything is kind of turned up a notch with the Lifelong Vitality. And you can see it help. It's great for stress, your immune, your hair, your skin. People sleep better at night because it's calming, but also because the pain that they experience isn't like acting up at night. Really great for your bones, your cardiovascular, your energy. So it's a really, safe kind of for everyone. It's a general supplement, but it really does up all those areas. So that's the longer term tune up that I personally use and love to recommend to my clients and customers. Pass it over to Colleen.
Thank you, Becca. I really enjoy those supplements. I use them every day, and I love how well they work. So today I'd like to talk about authenticity and communication, yoga and meditation, business and life problem resolution, and the release of trauma, panic, anxiety, and depression. Next slide, please. So let's start with authenticity, communication, and truth. What is the link here? A lot of people are talking about how they would like to be more authentic in their communications, more authentically being who they are in their life. And one of the things that's necessary for this is to communicate your truth in the moment. That's the start. The more you can communicate the truth that you have moment by moment, the more truth you put into the world, the more authentic you are able to be. And also the more people will see you from your truth. as you share it. Next slide, please. Another thing that's important is people think that their thoughts belong to them. They think they originate their thoughts, and you can originate a thought, but thoughts are things with they have their own reality. Have you ever had the experience when you've had a thought and someone else has had the exact same thought at the same time, and either you have spoken it before they have, or they have spoken it before you, which is clear evidence that the thought doesn't belong to either one of you. It exists in its own, it has its own existence. So the thing about thoughts is sometimes you'll have a thought and you'll believe it just because you have it, but you don't have to. A thought, again, has its own existence. You can believe it or not, and you can also agree with it or not. And I say this in particular, I want to talk about something that is a little bit heavy, but sometimes people, when they're feeling feelings of failure, they have thoughts of suicide. So you don't have to agree with your thoughts. You don't have to believe them either. Just because you have them doesn't mean that they're true, and it doesn't mean that you have to agree with it. Next slide. So our mind, our thoughts, and our communication. These things are, they work in concert together. Our mind, thoughts, as we talked about in the last slide, they have an existence of their own. And our communication is to communicate our thoughts to other people. That's the purpose of the communication, is for us to connect with other people and for them to connect with us. So one of the things to notice is your mind, are your thoughts, and are your communication carrying you in the direction that you want to go in life, or are they sabotaging you? This is an important aspect to recognize, because you are the boss of your mind, your thoughts, and your communication. You're the boss. And if you know that, and you get your mind and your thoughts and your communication in line, you can really go in the direction that you want to in life. Next slide. So yoga, meditation, and communication are tools that will help you to just know your body, know yourself, and deepen your connections. And this is the way to know whether it's like if you don't know what it is that you want in life, you can't get your mind and your thoughts and your communication in line. So you do have to do this inner work of knowing who you are. And yoga is exceptional at helping you to know your body. And it also will take you deeper and deeper. The more you get attuned to your body, the more it takes you right into meditation. It's kind of brilliant. It's amazing, actually. So yoga, meditation, and then communicating who you are to the people that matter in your life, so that you know your body, you know yourself, and you deepen your connections, because all of those things work together in concert. Next slide, please. So being happy is intentional. If you think about what our main ability is in life, it is choice. Having the choice of being able to say yes to something or no to something. And so if we understand that our main ability is choice, when something comes along, we don't have to go along just to go along. We can stop and take a moment and check in. Does this further where I'm going in life? And we can say, yes, it does. And we can say yes to it. Or if it's scary, does it take us in the direction that we want to go in? And then we can say yes. And if it's not right for us, we can say no. So living in peace and freedom is a choice. And self-awareness is necessary for us to make choices that actually bring us along on our path to happiness. So know yourself and know your passion. Next slide, please. Anxiety, panic, trauma, and depression. These are enemies of peace, freedom, choice, and happiness. And when they occur, they they block us. They create a difficulty. They create a barrier. And so being able to know how to get through the barrier is beneficial for us creating a life of happiness. So I help people move forward by identifying and healing triggering events. There's usually something that's happened that's created an event that has caused either anxiety, panic, trauma, and depression. But there's also a pattern that often people have. So education on how to stop continuing the pattern is important in releasing anxiety, panic, trauma, and depression. And then making an intentional plan towards peace and happiness. And these things are all possible. Sometimes people need help to get out of the difficulty that they have. So I'm someone who helps. Next slide, please. I think we should join the quiet revolution of being intentional, of knowing yourself and creating your life of freedom, choice, peace, and happiness. Thank you.
All right, thanks, Colleen. If anyone had any questions, there is a Q&A, two little bubbles on your screen. If you type them in there, we'd love to answer them live for you. So I'll give you a minute or two to think if you have any questions for the four of us. And if not, we'll go to our next steps. All right, we'll let you know what to do following this, how to connect with one or all of us. Daryl.
Sorry, we just might have a little bit of noises in the background, but yeah, if anybody wants to listen into their body, we can try the infrared sauna for half an hour at my clinic. So that's my offer for today.
Sounds like you tuned into the right station over there next to the dance studio. Another great way to be moving your body. Dr. Lisa.
Yeah, if you need help guiding and listening to your body, book in for a free 15-minute discovery call. I'll put the link in the chat and we can discuss my approach and your concerns and how I can help. And then on Monday, I'm starting my Sober Sugar-Free Reset Challenge. It's a 5-day challenge. You can get half off, so it'll cost you $25 instead of $50 if you use the promo code sugar-free. So sugar, it can taste good, but it can override a lot of our signals and kind of hijack our health if we get too much. So I'll post that in the chat for you.
Awesome. And if you are interested in trying any of the plant-based products, feel free to book a time and chat with me. We'll send a follow-up email and you can just click on the link. I'd love to hear what you're going through and see if there's something that I can help connect you to. And I'll also send a link. I'm an educator at heart and profession. And so every single week I'm educating about something. So I will send a link where you can come to any of the workshops. They're always free. And I'm sure you'll find a topic that will connect with you. So would love to see you at one of those as well.
Well, I want to say that I've used everybody's services here and they're amazing and awesome. I haven't actually seen Sean yet, but I've been to Daryl's clinic and I feel very helped by all the things there. So I'm looking forward at some point to checking Sean's stuff out as well. And I've used Lisa. I've done her. I've gone to see her as a naturopath, and I've done her sugar-free. I forget what you call it. The challenge, the sugar-free challenge, and it is amazing. So I highly recommend that. And I use Becca's. I have a ton of oils, like they're all over my desk, and I use the supplements. And Becca is she's a great connector. So she will, if she can't help you herself, she will turn you on to what you can be helped by. What I want to say to you is I am happy to speak with you for an hour about your journey. It's a free assessment. If you want to work with me further, then you can, and we can talk about ways to go forward. But it's like, what's going on in your life? Do you need more help with your body? Do you need more help with your business? Do you need more help with your soul? These are things that I can help with. And if you're struggling with mental anguish, I can assess that, and help is available. So reach out, get a connection, and come on over.
Thank you so much, Colleen. And you're in for a treat. It's Friday afternoon. I personally can't think of a better way to just kind of go out of the lunch hour right now, or whenever you're listening to the recording later. Colleen, please help us lead us into a beautiful meditation here.
Thank you so much, Becca. Well, let's take a moment and just get yourself so that you're sitting nice and comfortably in your chair, nice and tall, so that if you want to lie down, you can, like Daryl is, that's great. You can lie down, get yourself nice and comfortable. You can also sit upright in a chair so that your back is straight. And the reason that you want your back to be straight is that this is the position where your lungs can actually expand. If you're hunched over or scrunched up in some way, your lungs can't breathe as well. So let's just get ourselves set up so that for optimal meditation here. All right, once you're set up, either sitting or lying down, take a nice breath in and let yourself notice where you are. Notice how your body feels. Notice how your feet are. Breathe. Feel how your legs are. Continue to breathe. Let your chest and your diaphragm expand. Let your rib cage expand as you breathe. And drop right into who you are. Drop into your body awareness. Be aware of your torso, the lower part of you where your organs are, where your lower back is, your hips, your pelvis. Then moving up, you can feel your rib cage expanding and deflating as you breathe. Perhaps you're aware of your diaphragm moving as you breathe in and out. Perhaps you can feel your heartbeat. And feel your back, feel your spine, feel the muscles in your back. Feel your shoulders. Feel your chest. Feel your neck, your head, your face, your jaw, mouth, lips, teeth, tongue, nose, cheeks, eyes, eyebrows, forehead, your ears, your skull, and maybe you can feel your hair. And now notice your thoughts. And don't try and make them do anything. Just let them be. Let them float in and out without attachment or decision. Just letting them be. Notice that you are safe. Notice that you are clear. Just allowing yourself to breathe and be. Letting your thoughts be. Letting yourself be. Breathing. Dropping in. Noticing what's true. accepting yourself exactly as you are. And loving yourself exactly as you are. Continue to breathe. Breathing in through the nose, exhaling through the mouth. There's nothing to do right now except be who you are. There's no place else to be. With your eyes closed, move your eyes from side to side, looking left and right with your eyes closed. Breathing. Notice that you are safe. Let your eyes come to rest. Continue to breathe and accept who you are and how your life is. And taking one arm and drawing it across your chest. Just give yourself a little stretch. Take your arm across your chest. Stretch. Stretching your back. Breathing nice and deeply, opening your back lungs. And let's switch arms. Taking your other arm, bringing it across your chest. Opening the back lungs, breathing deeply. And taking your two arms and bringing them up right over your head. Stretching. And then giving yourself a great big hug. Oh, stretching the spine. And releasing. Opening your eyes gently and noticing the room that you're in. Noticing something real to you. Go ahead and touch something that is real in the space. Something you find real. Take a nice breath in. Come back to yourself in this space. And thank you very much for joining us today.
Bye. Thanks for joining us.
Thank you for joining us, everybody.
Colleen, that was so relaxing. Thank you.
Thank you. It was lovely to spend this time with you all.
Be well, everybody.
Thank you very much.